So this part of the assessment is active range of movement at the knee. So the client will be carrying out flexion and extension, and I'll be telling them how to do this and instructing them to glide their ankle along the bed and bring it as close to their bum as possible. This will cause the hamstring group to contract, so the bicep femoris, the semitendinosus and the semimembranosus. When they're coming down from flexion and into extension, I'll be asking them to push their knee into the bed, and this will activate the contraction of muscles such as the rectus femoris, the vastus medialis, vastus intermedialis and the vastus lateralis. For this part of the assessment, it will now be passive range of movement. So I will be taking the weight of the client's leg. I'll be getting them to relax as much as possible. So asking them to take a deep breath, and then I'll place one hand under the thigh and then bring it up. But as the knee begins to crease, I'll be moving it to on top of the thigh. And then again, moving to the other side and asking if there is any pain while they are doing the movement. Now we will be doing restricted range of movement, so I will be applying pressure while the client is doing the movement, and I'll be asking them to match my force. With knee flexion, they will be working their way through the whole range of the movement, so therefore it's an isotonic contraction. So I start by placing both my hands towards the Achilles tendon and just asking them to bring their heel to their bum. And then again asking if there's any pain, and then moving to the other side to do the same again, and then using the Oxford scale to grade the amount of force and strength they can produce. And then for extension, I will start them in a flexed position and place both of my hands on their shin, and then get them to work their way through the full extension of their knee, and then again I will move to do it onto the other side. And now we will be moving on to internal rotation and external rotation at the knee. So first, starting actively, I'll be asking the client to bring the soles of their feet in towards each other and then the soles of their feet away, asking if there's any pain and looking at that quality of the movement. So then we'll be moving on to passive, where I will be doing the movement, again getting them to relax as much as possible and just using my palm to create internal rotation by bringing their foot inwards, and then doing external rotation by using my palm and the inner bit of their foot to push it outwards. Again, checking for any pain and looking at their face for any hesitation. Lastly, it will be resisted range of movement. So I will be placing force. They will be matching that to see if they can match my force. For internal rotation, it will activate the semitendinosus, the semimembranosus, and the sartorius. And for external rotation, it will contract the bicep femoris. Lastly, for the functional test for the knee, I will be asking my client to perform a squat. So I'll just be explaining to have your feet hip width apart and then lower yourself down. I'll be watching for the quality of the movement and potentially any knee valgus or varus, and seeing how they do.